If your loved one was terminally ill, about to die, had cancer spreading through their body, what would you do? Would you let them just wither away, or would you try to help them? Because there's ways and methods out there that could help them, like physician-assisted suicide, for instance. A lot of people have no clue really what that is, but I'm here to tell you about that, and I'm going to help you understand why I think it's a good idea. First of all, there's a process of what they call euthanizing. And then there's the laws that are carried out with it. And then there's history behind people who committed suicide when they were ill. And then there's alternative options that I'm also going to tell you about. So we're going to start off with the process of euthanization. There's a ton of documentation that has to be done for the doctor to do this themselves. So in order to get this process started in the states that accept physician-assisted suicide, which I'm going to call PAS, they have to have a 15-day verbal, and then they have to wait another 15 days and have another verbal followed by a written. After that second written is done, they wait 2 days, and then they have to be talked to by another physician to make sure that they're mentally competent and it's okay for that first physician to have this done. This could be very hard for them and the family. You have to realize this, and it has to weigh on the physician itself, which many physicians were taught not to do these things because that's part of their oath. Once this process has been gone through, there's the types of ways to euthanize the person. First of all, that person has to be terminally ill. They have to have 6 months or less to live, and the physician themselves cannot give them the pills or the injection. They have to do it themselves. So it would start off with a barbiturate, which would put them in more of a calm state, and then after that they would take another pill, which the most common one is called Sectonical, which puts them in a comatose state, and from there on the physician would just stay there to monitor the heart rate and pulse to make sure that the patient passed away so they could document the time of death. That process costs about $125, so it's definitely a cheaper route. The other one is what they call liquid death. That is about $1,000. It's an injection that goes into the muscle or into the vein. It's called Nembutal. It's more of a faster acting than the other method. Then there's non-formal ways, which is kind of not done with the physician. In those states that we're going to talk about later that don't have physician-assisted suicide available. So we're going to skip down to the states that have those available, and then I'll tell you a little bit more about those non-formal ways so that you can really get a good grasp on it. So there's 15 states that allow physician-assisted suicide. It started in Oregon in 1994, followed by Washington in 2008, Montana in 2009, Vermont in 2013, and lastly California in 2015. Oregon paved the way to keep physician-assisted suicide going. It all started with terminally ill patients needing and wanting a different way out instead of having to be terminally ill and just suffering. I mean, I can totally understand that, can you? So then there's also histories of suicide and stuff like that. I mean, there's King Edgar in 967, sorry, it's kind of weird saying stuff like that, that would take the bodies of those who were terminally ill to be buried outside of town after they'd committed suicide because they did not want to be in pain anymore, and nothing would work to help with their pain. And then there was also the Catholics. When they would commit suicide, they would bury their bodies above ground for the shaming of them committing suicide against God. Then there was also stuff with history like the Hippocratic Oath. Doctors aren't supposed to do that. They went through school and they were taught that is not something you do. I wanted to read you a couple things just exactly the way they were worded, and I can't get them quite memorized, so I'm going to read them off my paper, just so that you get it totally clarified. It says that the original wording for the Hippocratic Oath, when it was first dated, says, "I will neither give a deadly drug to anybody who asked for it, nor will I suggest to this effect. Similarly, I will not give to a woman an abortive remedy, impurity or holiness. I will guard it in my life and in my art." Later on, it was changed to say that most especially must I tread with care in matters of life and death. If it is given me to save a life, all thanks. But if it may also be within my powers to take a life, this awesome responsibility must be faced with great humbleness. Hear that? Humbleness. And awareness of my own faculty. Above all, I must not play at God. So when I hear that, and I know that physicians really have a hard time with this, I mean, I get it. You're helping someone take their own life. But if my mother or my grandparents were terminally ill and they were suffering and they just wanted out, you betcha I would definitely try to help them do that. Not in a way that I would be killing them, but in a lawful manner, like hopefully physician-assisted suicide. Some of the other things that I was going to tell you about was the non-formal ways. So when I was doing the research for this, I found something called the final exit. It's kind of creepy. It was a whole Dateline story. Frontline, Dateline, one of those two. About how you can take your own life very simply. 2 helium tanks, duct tape, tubing, and a turkey bag. The first tank goes in, it just makes you kind of drowsy, and the second tank goes in, and you just pass away. They also have something called hand holders, where they come in and they hold your hand while you pass away, and then they just take everything and run, so that you aren't known for being that person. Pardon me. Although there are alternative methods that physicians might want to talk to you about, like hospice, which is definitely a way you could go, but that's a lot of morphine and benzodiazepams and stuff like that. I mean, it just makes you really drowsy. You don't really remember stuff, but you're still going to have quite a bit of pain, in my opinion. I mean, I'm obviously not terminally ill or dying. I have been in pain. I do know what it feels like. I don't know what terminal pain feels like. Then there's also palliative care, which you can go to when you are getting to the point where you just need extra help. And so it's kind of like it's like the step before hospice, or you just need extra help. So what it comes down to is, are you going to let someone suffer, or are you going to help them? There's all kinds of different ways. Why is this not something that is done? 2 of the candidates that ran for president during the last race were for PAS. Why was this not done? I think that it should be done in America with all the rights that everyone has through smoking, alcohol, gay rights, marriage, all these other controversial things, why isn't taking your own life when you are terminally ill something you can do? Why can't I help my mom? Why can't I help my dad? Why can't I help my grandparents? Why can't you help someone you love feel better and take them out of their misery? Can you tell me that? I hope this gives you a little bit more of an insight on that. And I hope you can tell me that you pick PAS.